go ahead and start off with you laying on your stomach face down. So you'll come right here with your stomach right here. Good. Now, one of the things that we're going to be emphasizing is that when somebody comes into the office, such as yourself, you were looking for specifically prenatal chiropractic care with an emphasis for the Webster Technique. And you know, the Webster Technique is really well known for helping with intrauterine constraints, things that contribute to breech presentations, and we still use this technique on you proactively. Even though your baby is not in an abnormal position, we're going to be making sure to work with the pelvis and the sacrum, things that help with the baby inside. And when we look at this, we're looking for hip tension. And with your body, what we're seeing here is in comparison to the left and the right, that left side's extremely tight. So what we're going to do is we're going to start with a very light adjustment to the sacrum. So the purpose of the drop technique is to make it easier on your body. We're just going to find the perfect tension. Good. Now what we're going to do is work on some of the ligaments. And these ligaments, I use an instrument that helps to relax the ligaments. First one is this ligament right here, the sacrotuberous ligament, and this helps with the movement of your hips. And then we're going to work on just the ligament that supports your sacrum. Perfect. Let's have you lay now on your opposite side. Now this is where I'm going to deviate from the traditional protocol just a little bit. There's a little bit of rotation in your lower spine. So I'm going to just do a little bit more. This will be for the lower back. More. Okay. I'm going to now work on your mid-spine, and we're going to bend those right there. Place your arms right here. Bring your chin up just a little bit. Okay. Now, with your neck, a lot of tension here at the base of the neck, and even though neck pain may have nothing to do with your baby, it's going to have everything to do with the nervous system what's inside. So, even though your ligaments are more in a relaxed state, we're going to be very cautious. Now, the next thing we're going to do is look for hip tightness, and I do so with your arms. Go ahead and point your fingers straight out. Perfect. Just a little bit of unevenness on your left side. What I'm going to do here is work on this hip flexor, and this hip flexor attaches to your lower spine and can actually cause this, tightness, tension in the lower back. Good. Now we're going to work with the area right here with the round ligament, and pressing on this, I actually feel more tension right here on the left. So we're going to just put a little bit of pressure on here, at the same time working on the opposite hip. This is where if you have tension in the round ligament, it can cause localized pain, which round ligament pain is super common, or from a proactive approach, it can contribute to the baby rotating in utero, just kind of adapting to its environment. And now, the next thing we're going to look for is within your hips. So, this one moves, this one's tight. We're going to do very light, just a little bit of mobilization. Now, let me see your hands one more time. Point your fingers towards me. Good. So now what we're doing is seeing evenness. And what I'm doing here, putting pressure, being as light as I can. Good. Perfect. Now, let me have you sit up and face the green wall. Alright, so the next thing I'm just going to focus on is we had seen on your posture assessment that your head was slightly shifted forward. We're going to just very relaxingly help to put that curve back into your neck. This is all emphasizing just normal mechanics of the spine. Okay, one of the things that you're doing the best is being proactive on it, because A lot of times women come in like 36 weeks, they're freaking out, breech presentation, they got like 2 weeks to decide, get the baby turned or have a C-section, and with the proactive approach, we will not have to put ourselves in that situation. And God forbid, in the event that there was any sort of change in utero, we would already know what your body patterns are, and then we could start working with other areas. So